Now we talk about the ilium and the pelvis from the posterior side. This is the iliac crest, the posterior superior iliac spine, the posterior inferior iliac spine, the greater sciatic notch, the ischial spine, and the ischial tuberosity. Here we have the iliac tuberosity. From it we see the acetabulum. From the acetabulum we put the head, the neck, the greater tuberosity and the lesser tuberosity. Here we put the sacrum, which is connected to this part by the sacroiliac, dorsal sacroiliac ligament, and here you have the L5 transverse process, L5 vertebra transverse process, which is connected to the posterior superior spine by a ligament which is called the iliolumbar ligament. If this iliolumbar ligament ossifies, then it is called a sacralization of the lumbar vertebra. The next ligament you have is the sacrotuberous ligament, which is attached to the medial half of the triangular portion of the ischial tuberosity. You would remember that the ischial tuberosity has a posterior quadrangular area and a inferior triangular area. So the triangular area medial half gives the attachment to the sacrotuberous ligament. So this is the sacrotuberous ligament, and the sacrospinous ligament from the ischial spine goes and gets attached to the sacrum. Now, from this iliac tuberosity arises the tensor fascia lata, which converts into an iliotibial band. Now, this iliotibial band, there is this intertrochanteric crest on the anterior side of the trochanter, which spirals round, forming the lateral spiral line, and there is an intertrochanteric line like this, which spirals round, forming the medial spiral line, and both form the lateral and medial lip of the linea aspera. And this iliotibial band is attached to the lateral lip of the linea aspera, forming a lateral intermuscular septum. So, if we see it in section, you will see that there is this medial and lateral lip of linea aspera, and this is the section of the femur. The deep fascia is coming like this. It is strengthened by the iliotibial band and going behind like this, and the iliotibial band is connected to the lateral lip of the linea aspera, having an anterior and a posterior compartment in the thigh, and this is the attachment of the iliotibial band. Now we begin from inside. Here is the acetabular labrum, and outside the acetabular labrum, below it, corresponding to the acetabular labrum, is the transverse acetabular ligament, which is actually, if this is the articular portion of the acetabulum, the transverse acetabular ligament is like this, and ligamentum teres arises like this, and behind the transverse acetabular ligament, through a notch in the transverse acetabular ligament, the artery or ligamentum teres arises from the obturator artery and goes and enters the head. So if you want to make it in this section, here will be the ligamentum teres, and here will be the artery of ligamentum teres coming, riding on the ligamentum teres and supplying 3% of the head. Now, after this, there is also the medial and the lateral circumflex femoral, the ascending branches of which enclose the base of the neck, which gives posterior and anterior reticular vessels, which cross the growth plate, and supply the head. So the head is supplied by anterior and posterior retinacular vessels and artery or ligamentum teres, and both of them can get compressed in case the synovial pressure increases beyond a certain limit. Now we have the capsule, and this capsule leaves the lateral 1/3 of the neck out. The capsule is strengthened by a ligament which is called as the ischiofemoral ligament. So the iliofemoral, the ischiofemoral and the pubofemoral ligaments. Then after this, from the external surface of the obturator foramen comes a muscle, and this muscle winds round the neck of femur and gets attached to the trochanteric fossa. Posterior to this muscle, you have the quadratus femoris. From the outer half of the ischial tuberosity, you have the adductor magnus. All these muscles are attached in the medial lip of the linea aspera. So, this is the adductor magnus, and here you have the quadratus femoris, and now above the quadratus femoris, a muscle emerges from the greater sciatic notch and is attached to the tip of the trochanter. This muscle is called as piriformis. Then there are structures above the piriformis and below the piriformis. Those above the piriformis are superior gluteal artery, vein and nerve. Below the piriformis are inferior gluteal artery, vein and nerve, 3 nerves and pin structures. So, we'll say you have inferior gluteal artery, vein and nerve, 3 nerves and pin structure. The 3 nerves are the sciatic, posterior cutaneous nerve of thigh, and nerve 2 quadratus femoris. So we'll make these nerves here. Here is the sciatic, the posterior cutaneous nerve of thigh, and a nerve which goes to the quadratus femoris below the piriformis. And the pin structures are the pudendal nerve, the internal pudendal artery, and another nerve which goes to the obturator internus. The obturator internus emerges out of the lesser sciatic notch and goes and attaches to the intertrochanteric crest and we'll make this, because this is the tendon, we'll make this as green, perhaps blue. Okay. So this is the obturator internus tendon. Above the obturator internus is the superior gemellus, and below it is the inferior gemellus. Then the gluteus medius, arising from this part, goes and gets attached to the tip of the trochanter. This is the gluteus medius, and anterior to it you can see the gluteus minimus, and all of this is covered by the gluteus maximus, which arises from this part of the ilium, the sacrotuberous ligament, and this muscle we'll make in red. So this muscle comes and gets attached to the gluteal tuberosity at the intertrochanteric crest. So this is the gluteus maximus. Now we will see the same thing on the bone. Okay. So we open the anatomy. We are seeing this bone, we go behind like this, and here you can see beautifully the sacrotuberous ligament, this one, the sacrospinous ligament, this one, and you can see the acetabulum. We can make the labrum here, and the transverse acetabular ligament here. We can bring that arterio ligamentum teres through this, climbing on the ligamentum teres and entering the head. Then we can make the capsule. Lateral 1/3 of the neck is left out. Then we can make the obturator externus arising from the outer surface of the obturator foramen, coming and getting attached to the trochanteric fossa of the femur. Then we can make the ischio-femoral ligament which strengthens the capsule. Then we can put in the quadratus femoris muscle, and from the outer half of the triangular portion of the ischium we can take out the adductor magnus, which is attached to the medial lip of linea aspera, and on the medial side of this muscle is your gracilis. So we have made adductor magnus, quadratus femoris, obturator externus, ischio-femoral ligament, capsule. Then we take out the piriformis arising from the anterior surface of the sacrum, coming out like this and getting inserted into the tip of the trochanter. Structures above the piriformis are superior gluteal artery, vein and nerve, Below are the inferior gluteal artery vein and nerve, three nerves and 10 structures. The three nerves are the sciatic, the posterior nerve of thigh, and nerve 2, quadratus femoris. The pin structures, we'll make the pudendal nerve as representative, will come out of the under the piriformis and will enter the Alcock's canal here to go into the perineum. So this is the pudendal nerve, internal pudendal artery, and nerve 2, obturator internus. So there is an artery here, and there is nerve 2, obturator internus, and of course this third nerve will go here. And what will happen to the obturator internus? Obturator internus will arise from the inner surface of the obturator foramen, come out of the lesser sciatic notch, and get inserted onto the intertrochanteric line. So this will form a tendon here. This is the tendon of the obturator internus, helped superiorly by the superior gemellus, inferiorly by the inferior gemellus, and below this you have the quadratus femoris, and then you have the adductor magnus. Now from the middle of the iliac crest, from the middle of the ilium, from this area, arises a muscle which is called as gluteus medius, which goes and gets attached to the tip of the trochanter. So this muscle is gluteus medius. Alright. Greater sciatic notch, superior gluteal artery vein and nerve, piriformis, then inferior gluteal artery vein and nerve, three nerves, and the pin structures. Okay. From the iliac tuberosity arises the tensor fasciolata, okay, which becomes the iliotibial band, which iliotibial band is connected to this lateral lip of linea aspera by a septum which is called as the lateral intramuscular septum. So these are the structures that you see in the next layer of in the second layer of the posterior side. Tensor fasciolata, gluteus medius, piriformis, superior gemellus, obturator internus, inferior gemellus, quadratus femoris, adductor magnus, and on this side the gracilis. So this is what you see here. Deep to it, you will see the acetabulum, the labrum, the capsule, the ischiofemoral ligament, the obturator externus tendon till you reach the gluteal tuberosity. Now we do away with this and tell you the origin and insertion of gluteus maximus. So gluteus maximus would arise from this area. It will arise from the sacrotuberous ligament right up to here. So the gluteus maximus muscle will be attached to the gluteal tuberosity here and will be also attached to the iliotibial band and its lateral intramuscular septum. So let us make this attachment. Here it comes and here it comes. So it is attached to the iliotibial band, the lateral intermuscular septum, the gluteal tuberosity. And it covers every single structure that we have described up to now. So this is the posterior view of pelvis.